Hi, Kim.
Good morning, Debbie.
Thanks for coming in.
No problem.
We've been working on type 2 diabetes for a long time. We've tried a lot of different medications, but we need to really look at that next step today. That A1C has gone from 8.8 to now most recently up to 9.2.
I've been taking my medication. Why is my glucose going up?
Well, that's a great question, and it's nothing you've done wrong. What we know with type 2 diabetes is that over time it continues to progress. And so even though we've tried different medication combinations and you're doing your best with eating carefully and exercising, we know that it continues to progress and we may need new or different medications. In fact, the American Diabetes Association has a chart that they share with us when we're thinking about medications and what to try and what would make sense. And so just as kind of a review, we started with metformin. And when you took that, you had some diarrhea with that and gut problem. So when you came to see me, we changed that to the metformin extended release, and that helped. But then soon thereafter, you needed something else to help with the blood sugar control. And at the time, as I recall, you didn't have insurance, so we used a generic sulfonylurea that helped squeeze a bit of insulin out of your pancreas. And then you were able to get insurance, and we tried the GLP-1 receptor agonist, Victoza. The generic name for that's liraglutide, but that injection you took for a while. And that was a bit costly, but then your insurance changed, and most recently then, almost a couple of years ago, we tried the SGLT2 pill, which is the pill that helps kind of tell the kidneys, push the glucose on out, don't just recirculate it all the time. It's been through once, just get rid of it. So we've tried a lot of very good medications and have had some good results with those. But we're seeing that A1C now be over 9%. So we've just got to take that next step.
Right. I've been through so many different medications which have cost so much money. I'm just starting to think that I'm not going to get a good control of this glucose.
Oh, no. We'll help you. We'll help you get good control. But we've talked about insulin in the past, and I think that indeed is our next step.
I'm really afraid of taking the insulin. You remember I had some problems when I was driving, and I don't want to have that lightheadedness. I've also heard that you can't drive when you're taking insulin.
Great concerns, great questions. So indeed, there is the possibility of low blood sugar with insulin, but the insulin that I think we should start with is the long-lasting basal insulin. It's one injection a day, and it's very flat, but it helps helps lower your blood sugars all across the board. And the risk of low blood sugar with that is very, very low. But the good news about driving is that you can indeed apply for a waiver for your commercial driver's license. So having a CDL and being able to continue to drive while you're on insulin is indeed possible. There's some forms, there's some paperwork. We have to have good blood sugar record for a month. You take that to an appointment with the endocrinologist. They sign off on that. You have to have an eye exam. But those are things you would do anyway. So that eye exam will just give you the forms. So when you go, it's time for your annual eye exam now. So you take this and have the eye doctor go ahead and sign off on that.
Okay. And what about work?
Yes. So you will have to be off work for a month while we get good blood sugar control. Do you think your employer might let you do desk work for a month?
I can try talking to them. This just all sounds really complicated.
Mm-hmm. Well, there is a lot to it. There's no question about it. But if we can do what we need to do and get good control, I think we can get you back on the road again really fairly soon in the big scheme of things.
Okay, I don't think I can do this alone. Another problem that I'm worried about is on the other medications I was gaining weight. Is that going to happen on the insulin?
Well, good question. And again, with the oral agent, the sulfonylurea, that worked by squeezing insulin out of your pancreas. And so if you did have that dizziness or lightheadedness, you had to stop and eat something. And those were extra calories that got stored away as weight. With insulin, indeed, there may be some weight gain. Right now, your blood sugars are very high, and so when you eat food, it breaks down to sugar. You don't have enough insulin to help get that glucose out where it needs to be, so you're peeing all that glucose down the toilet. When we help you get started with insulin, that will help the glucose get escorted to the muscle cells and fat cells. You'll store it, you'll use it. So we do need to be very careful when we're helping adjust the dose, that we don't have the dose titrated a little too high, making it the verge of low blood sugar where you do have to eat extra calories.
Okay.
So we'll stay right on top of that with you. We'll need to touch base every week or so to help get the dose adjusted just right.
Okay. Will the insulin be expensive? Are there other medications that I can stop to help cut the costs?
That's an issue with your $5,000 deductible. I know that's a huge issue. So the metformin we need to keep, and that's very, very cheap. The SGLT2 that you're taking now, are you using the copay card that we got? Okay.
I am.
So the cash value with that goes toward your deductible. So that will be a big help. And indeed, the insulin also has a copay card. So that will help with the cost on that. So I think we can make this doable for you.
Okay, let's go ahead and try the insulin then.
Great. Well, let me help you with it. I want to give you a sample, and indeed, I want to help you with your first injection today. So go ahead and open that, and that's a pin, and I've got the instructions here. I'll just put that right in front of you. Take that end cap off of there, and the insulin is in here, very much like the other injection you had. It's a pin.
Okay.
So here's the pin needle. So take that and take off that paper tab, and you remember how to put the pin needle on there. It's the same kind of process. So when you do that, take off that cap, take off the green cap, and then there's that little tiny baby needle. On your dose knob, dial 2. We're already way down here on the instructions. Hold it straight up and push real firm. We want to make sure there's medication at the tip of the needle. Okay. Now the dose is weight-based, and so the dose is 10% of your body weight or 0.2 units per kilo, which you don't have to remember, of course. But we'll start with 20 units.
Okay.
So dial 20. Okay, and hold it like your pin. And then we'll have you go ahead and give it, maybe in the tummy would be great. So you put it in, push, and hold 2, 3, 4, 5, 6, 7. You're done. All right. Awesome, Miss Kim. So go ahead and take that pin needle off. And in Colorado, you're able to put that pin needle in a coffee can or a Clorox bottle. You don't have to have a red needle box. But when that is full, you can tape it, mark it medical, and put it out with the trash.
Oh, okay.
Okay. So your insulin does not have to be refrigerated, so you can take it with you while you're on the road, and it needs to be given about the same time every day.
Okay.
Okay. And I'll help you with adjusting the dose. You can increase the dose every couple of days, and I'll write that down for you because we want to get right on this so we can help get those blood sugars down and get that month of good blood sugar control going right away. Do you have a sheet to write?
I'll take another one.
Okay. And this is what you'll take back to the doctor. You'll bring this to me. Can you send me numbers next week?
Sure.
Fax or scan it or something? Okay. And then we'll talk. Can you come back for a face-to-face in 2 weeks?
Absolutely.
Okay. So we'll work from this. This will be our master sheet. And then this is what you will take when we get that 1-month appointment set with the endocrinologist.
Okay.
Okay?
All right.
Any questions?
Not right now.
Okay. Well, just let me summarize a bit. So, yes, we need insulin, but you have not done anything wrong. So don't feel bad. Don't carry around a bucket of guilt. We just need to get those blood sugars in good shape because I don't want you to have complications. And we can do the paperwork, and I'll help you. I'll help get that appointment with the endocrinologist so we can get things signed off and try to get you back on the road.
Okay.
The low blood sugar, you remember that.
Right.
Dizziness.
The dizziness and the nausea and the sweating.
Okay. So if that happens, if you're on the road, you get a couple of glucose tabs in. You've got glucose tabs with you?
Always carry them in my
Okay,
purse.
awesome. So you start chewing those right away while you're pulling over. Then you'll need probably a total of 3 or 4 glucose tabs. So you would check the blood sugar, get those glucose tabs in, chew them up. They'll take about 15 minutes to get the blood sugar popped back up, and then check, make sure your blood sugar came up okay.
Okay.
If you're more than an hour from your next meal, go ahead and have some peanut butter crackers or a snack. Okay, can you do that?
I can.
All right. Well, you are amazing. So I'm really proud of you for taking all this on.
Thank you.
Okay. Well, thanks for coming in, Kim.
Thank you. Thanks, Debbie.
You're welcome.